So to continue, so we were talking about delegation and what we could not delegate. So assessment of a patient's wound, for example, would be an example. If you delegated to a tech to go and change a dressing that was soiled, for example, that would not be appropriate for you to do in this sense, because when you as a nurse change a dressing on a wound, part of that task involves assessing the wound. And you are not going to assess the wound if you're not there present doing the wound dressing change. So independently, you could not send a tech to go and do that, or a UAP to go and do that task, because they cannot assess the patient's wound. Only the nurse can assess the patient's wound. All right, so delegation involves 5 principles. The 5 rights of delegation, then, we're going to call them. The right task, the right circumstance, the right person, the right direction or communication, and the right supervision and evaluation. So the right person, or the right task, the right task. The delegator must ensure the task is one that can be delegated, for one thing. Then you must also delegate only after you determine that the task addresses the patient's needs and contributes to the desired outcome, and that adequate supervision is available. So some tasks you can say, I'd like for you to help me do. So if you're there asking for assistance, then that's okay. Delegators must assign a task to a delegate that has the necessary skills and experience. So skills and experience are important. The task must be within the practice scope of the delegate's scope of practice, in other words. Delegators must provide clear, concise description of the task along with its objectives, limits, and expectations. So that's really, really important also while you're delegating a task. And the delegator must monitor and evaluate the performance after it's done. So you are still responsible. You still hold the full authority and responsibility of whatever task you are delegating. Remember that also. So I have a couple questions, and then we're finished with this lecture. An unlicensed assistant's UAP has previously performed patient transfers safely, bed to chair, on many occasions. It would be inappropriate to delegate this unsupervised task to the UAP under which circumstance? So your choices are: the unit had a new wheelchair, A, that's letter A. Letter B, this was an older client, C. It was the patient's first time out of bed after surgery, and D, the UAP has just returned from an extended leave of absence. So 2 things you have to remember. And this is in your textbook, so I really encourage you to review delegation principles in your chapters. In order to delegate, we said the delegate has to hold the proper skill set, right? And it has to be within their scope of practice. So other things to consider, though, when we delegate tasks to an unlicensed personnel. The patient has to be considered stable, and the patient task has to be one that is predictable, the outcome. So in this case, a fresh postoperative patient is not deemed stable. They are considered unstable. And the first time getting out of bed for this post-op patient is not predictable what the outcome is going to be. So the nurse needs to be present for the first time this patient gets out of bed. So the correct answer here is C. You cannot delegate that patient to the UAP, even though it is within their scope of practice to get a patient out of bed. But in this case, the full definition does not fit their scope of practice. Okay. The next question, the nurse asks a UAP to weigh a patient. The UAP carefully assists the patient out of bed to stand on the scale, weighs the patient, and safely returns the patient back to bed. Later, when the UAP reports the weight to the nurse, it is discovered that the patient had been placed on bed rest and should not have been allowed out of bed. This situation violates which of the following 5 rights of delegation? Okay, so if you picked letter C, then that's the correct answer. The right person, right task was the responsibility of the nurse to inform the UAP of the patient's orders. So the nurse did not fully communicate the task at hand, how to do it. And so that way there wasn't clear directions given when they delegated this task. Okay, that's the end of this lecture. I hope it was a good overview for you and you learned something new about management of nursing care. And I can be reached on Canvas. If you have any questions, please don't hesitate to notify me. I will have a discussion board set up for you to submit questions for this section. And thank you and good luck.